Good evening, everyone. My name is Jessie Phelan. I am the Deputy Director for Public Health Sauk County, and I would like to welcome you to tonight's event and thank you all for attending. Today's meeting is brought to you by our Sauk County Health and Wellness Steering Committee, which consists of folks from the Ho-Chunk Nation, SSM, Sauk Prairie Healthcare, Reedsburg Area Medical Center, and Public Health Sauk County. The data that you will see today stems from our Community Health Needs Assessment, where the top three issues identified this round were housing, mental health, and substance misuse. We know that there are other issues that our Sauk County residents face, but these are the top three that we'll be focusing on this evening. And we also recognize that many of these concerns intersect and overlap. And though we are making progress, there's still more work to be done. And that's part of why we are doing this event this evening, and your participation tonight is greatly appreciated. Thank you again.
Thank you, Jesse. Really appreciate that great welcome. I'm Siobhan Allen. I'm the Health Data Analyst, and I'm going to start out by sharing some of the community health assessment process. So we do our community health assessment. It's conducted every 3 years in partnership with our area healthcare systems. And during our health assessment, we collect a lot of data. We do this via a confidential and anonymous survey. We conduct focus groups. We do one-on-one key informant interviews, and we also compile a lot of secondary data from credible local, state, and national sources. So we're going to go over in this presentation some of the community health assessment survey results. So we're going to get to dive into the data. Overall, we received 1,106 survey responses. That's about 1.6% of our Sauk County population. And then when we look at our survey, we ask some demographic questions. And when we look at those demographic questions, we want to see how representative our survey was. That is, did our survey include all the different groups of people that live, learn, work, and play here in Sauk County? So when we look at the demographics of who took our survey compared to the demographics of Sauk County, we see that there are a couple of groups that are underrepresented. So the chart here on the screen shows that our survey underrepresented men. Only 21% of our survey respondents were men, where they make up half of our Sauk County population. Our survey also underrepresented youth respondents. Only about 1% of our survey was answered by youth, whereas they make up 22% of our population. When we look at educational attainment, those without a high school degree or those with a high school degree as their highest level of educational attainment made up 16% of our survey population, but they make up 39% of the total Sauk County population. We also, in our survey results, had about 5% answered by people of color, whereas they make up about 11% of our Sauk County population. When we look at other language speakers, they were about 2% of our survey respondents. We also were underrepresented in renters, being 23% of our survey respondents versus 30% of our population, and then also those that were below the median income. So when we look at our survey respondents, we need to remember that it may not give a complete picture of the responses or the experiences of all groups of people. So on the slide now, you can see that we asked people to think about their community, where they live, learn, work, and play, and what do they like best about it. And overwhelmingly, the most common response of what people liked best about their community is the parks, the trails, and the recreational opportunities. And we have a lot of many beautiful parks and opportunities here in Sauk County of the natural attractions for us to enjoy. The second most liked thing about our community is the size and location. Being close to family and friends was the third most selected response. Safety being the fourth. And then commute time and traffic and air and water quality both tied for the fifth thing that people liked best about their community. Then the next thing that we asked was for people to think about their community and what are the biggest problems. And housing was the top selected community problem, followed by mental health. The third was alcohol, commercial tobacco, vaping, and other drug use. Childcare ranked fourth, and then the needs of older adults and those with disabilities ranked fifth. So we did use our survey responses to prioritize which areas we're going to focus on for our community health improvement processes. And the top 3 responses were selected as the health priority areas. And we'll be discussing these more in depth in just a little bit. Now, we do understand that a lot of these problems overlap and that different groups of people have different experiences and different health outcomes. So, as we talk about things, we may see that other problems come up during our discussions. So, if you look on the screen, you can see those top 5 areas are highlighted. When we look at those by different groups, we compare them to see if different groups experience different things. So when we look at the data by those with children and those without children, we can easily see that those with children are more likely to select childcare as a top community problem. And so one of our survey respondents shared that they spent $26,000 in daycare costs for 2 kids in 2023. Does not leave extra money for other things like healthy foods or contributing to savings or retirement. So we can see that this impacts this family in different ways. We can also see that the families with children also selected transportation as a top 5 community area. Let's look at some of the other data. Next slide. So this chart shows us the top 5 community problems by different age groups. So we're going to take a closer look at the under 18 group. Next slide, please. And we see that the under 18 age group picked loneliness and social isolation as their third community problem, most selected community problem to pick. And one respondent shared that there's not much to do around here for teens. It feels empty here. So when we're looking at mental health and loneliness, we can take into effect that youth are going to be impacted by this problem slightly differently. We can also see that the people don't get enough exercise and racism and discrimination were also picked by that youth age group. Now, when we look at the other end of the age groups, when we look at that 45 to 64 and the 65 plus age group, we see that they were more likely to select the needs of older adults and those with disabilities, something that we would expect to see. Some of them shared that we need more services as we age and want to live independently. And another respondent shared that I feel that the majority of programs and assistance focuses on people who have children, and the elderly are more or less forgotten. Another area that was more likely to be selected by the 65 and older group was transportation. And a survey respondent shared, I think about when I'm unable to drive anymore. I live alone on a farm. My children live out of state. There's no public transportation nearby. How will I get to the doctor or get groceries without going broke? So you can see the qualitative data, that is the comments that people shared, we can use to see a little bit more of what people are experiencing in different groups. So next we can look at the different groups of income. And we see that transportation is being selected again for the lower income ranges, which was really shared in that last comment about worrying how that individual was going to get around when they can't drive anymore without going broke. We also can see in that 24,000 and less household income that dental health was selected as a top 5 problem. So specifically, some of the respondents shared that we need more dentists to take badger care. They don't take it because they lose money if they do. The state doesn't reimburse them enough. We also need affordable dentists. Most people don't have an extra $600 to fill a cavity. So maybe a list of badger care accepting places and places that will take payments or reduced rates. And another respondent shared that dental health is too expensive, and most who do not even have insurance can't afford to go to the dentist. They get their teeth pulled instead of fixed. So it gives a picture of how the affordability of the dental care is another barrier. Another group that we looked at is the responses of other language speakers. And we see that dental health coming up as the tie for their most important community problem. We also see the transportation and then the substance use and racism and discrimination. So one of our Spanish survey respondents, we translated their response and they listed racism because we're Hispanic and some people from the US treat us poorly and rejection. We also looked at the community problems by race and ethnicity. And again, we're seeing that racism and discrimination are being picked by our people of color in Sauk County. Next slide, please. And some of the comments here explain this further. So we have a survey respondent that shared, many in the area are totally distrustful and unwilling to accept people of color. Anyone that resembles someone from south of the border, even those that are here legally, are distrusted at best and hated at worst. And another respondent shared that racism and discrimination continue to be a very real issue in Sauk County, and it would be great to do more DEI workshops and have more conversations about this. So next, we're going to go over to Menti to get some feedback from you. So if you would hop over to the Menti, you can see there's a QR code on the screen, or you can go to menti.com and enter the code 2548682. And if you could share with us, what do you think about the community health assessment data that was presented? We'll give you a couple more moments to get your thoughts into Menti there. There we go. So we have some comments saying, striking that youth are experiencing loneliness. We have insightful data. Large degree is as expected. We have a comment of housing becoming more of an issue. Discrimination is not a good thing for our area, and not having things for youth has been a challenge. Thank you for the comment of it was presented in a way that was easy to understand. We have a good to remember the survey group does not fully reflect our population. We have a comment on missing the personal disparities. Some families struggle with things such as abuse, and these surveys are a way for this to become known and for help to be implemented. Thank you for sharing that. So due to time, we're not going to be able to read and review all of the comments, but know that we are collecting all of the comments shared, whether it's through Menti or through the chat during this, and we will be using those comments as we work on our community health improvement planning process. So next, I'm going to be handing it back over to Jody, who's going to be continuing with some of our health priority area discussions. Thank you, Jody.
All right, so the rest of this evening's presentation will be focused on the different approaches that public health is taking to address the numerous issues that Siobhan shared earlier. Myself, along with my coworkers, Sarah, Kate, and Hannah, will each be sharing specific health improvement programs that we facilitate to address the concerns that our community has brought to light. So health is everyone's business. We all want to make our communities healthier places to live, learn, work, and play. Much like a municipality's responsibility to create a comprehensive plan, Public Health Sauk County and our local healthcare systems jointly conduct a community health assessment and improvement plan every 3 years. Once again, this assessment has shown us that our community believes housing, mental health, and substance use to be the 3 most important priorities that we should focus on. So where you live has a major impact on your physical and mental health and well-being. All people deserve to live in decent, stable homes at prices that they can afford. Housing was ranked as the #1 issue in the 2024 Community Health Assessment Survey, the focus groups, and our key informant interviews. Between insufficient rentals and lack of starter homes, Sauk County families are struggling to find housing at a variety of price points. So due to a large variety of factors, 1 in 4 Sauk County households are stressed by high housing costs. This means that they are paying 30% or more of their household income on housing. So if we were to crunch the numbers, that means that 6,637 families in our county fall into this category. So just kind of, take a minute to think about that, because that is a lot of families that are really being impacted on this issue. So this affects renters, though, at almost double the rate as our homeowners. And then if you look, one of our survey respondents put in our survey, my low-income elderly mother-in-law had to move to Columbia County to get low-income handicap accessible housing. Moving away from friends and family has increased her isolation. So not only, does this affect the matter of her housing, but it also increases her isolation and her loneliness. So why is housing such an issue here? One of the reasons is that there is an insufficient supply of housing at diverse price points. So rental costs in Sauk County are higher than the 2024 fair market rent rates set by HUD. So this means that families cannot find rental units at fair market prices. Anecdotally, we are hearing that two-bedroom rentals are going in the $1,200 to $1,400 a month price range. This is $200 to $400 over that fair market rent rate. In August of this year, the median listing price of a house in Sauk County was $546,000. Mortgage on this home would be $3,347 a month. And to kind of put that into perspective, to afford this, a household would need an income of $133,880. Or that means two adults would have to be working full-time, each earning at least $32.18 an hour. And unfortunately, this is well over what Sauk County's median household income is of $80,070. So if you think of it, between insufficient rentals and a lack of starter homes, our families in our county are really struggling to find affordable housing at various price points. So for a quick recap, our issue is that 1 out of every 4 households in Sauk County are stressed by high housing costs. A huge reason for this is an insufficient supply of housing at diverse price points. So what have we been doing as a team to work on combating these issues? At this time, our action team has been publishing a quarterly newsletter and sharing education for our municipal leaders that highlight best practices and current and planned housing developments in our county. So we are trying to help enable them to be ready when developers come and want to build in their communities. Thinking of our team's vision, it's that affordable, equitable, safe, and diverse housing options should be available for everyone in Sauk County. The next thing that I want you to be thinking of is, what else do you think that our action team, should be doing to improve housing? So once again, I'm going to ask that you go to Menti. You should just be able to scroll ahead to the next screen and type your thoughts into the chat. And I am going to go ahead and stop sharing this screen and go over to Menti, and hopefully we can see some of your great ideas there. Okay, so hopefully you see on the screen the Menti here. So if you could just put in Menti some of your ideas that you might have for our action team to improve housing in our county. So some of the responses that we've gotten are municipal leaders should be involved. That's a great one, definitely. Oh, thank you. Great question. Policy changes in some regard. Yep, definitely. That is definitely something that we see. A hard thing for us is that all of our municipalities seem to have different policies, different zoning regulations. So that is something that we really need to work on. The next response was, our zoning laws are outdated and keep innovation low. Yep, we are definitely finding that. We need to encourage developers to build more affordable starter homes. How is our newsletter distributed? Great question. Right now, it's sent out to a list we have of all of our municipalities and everyone that is on our housing action team. So at the end of my talk here, I will put my email in the chat. And if you're interested in joining us, all you need to do is email me, and I would love to get the newsletter to you and have you a part of our team if that works. Okay, we have efforts to attract low-income housing complexes, as well as modest home construction from developers. All new houses don't need to be elaborate. Very true. Consider hybrid housing model for low-income young families with elderly and those with disabilities. Update zoning to encourage multifamily units, definitely. Invite landlords to the table for a discussion. Listen to those who are needing assistance and find that assistance. Some have housing issues that not many can solve or know where to direct them. People fall through the cracks quickly, unfortunately. That is very true. Financial supports, raising funds to support others in the community, and there's no incentive for landlords to lower rents. Very, very true. All right, you should see on your screen then our housing action team. So we meet virtually every month on the third Tuesday from 1 to 2 p.m. If you are at all interested in joining us, as soon as I switch over to Sarah presenting here, I'm going to put my email address in the chat. And if you would email me, I would love to include you in our meeting and our newsletter. So thank you very much, and I will turn this over now to Sarah.
Hello, everyone. We are going to talk next about mental health, which was the second top most selected priority on our community health survey. So I encourage us all to think about mental health here really broadly. It includes our emotional state, our psychological state, our social well-being as well. And of course, it affects how we think, we feel, how we act. It helps determine how we handle stress, how we relate to other people, and how we make choices. So mental health is super duper important. A little bit of data for you. When our mental health action team first formed, we focused a lot on how we don't have enough mental health care providers. And if you've looked for mental health services, perhaps you will agree. We know that there's a need. For example, 1 in 4 of Sauk County adults have been told that they have depression. So there's a need for mental health care providers, but our ratio of population per mental health care provider is too high. So here, a big number is bad. And in Sauk County, we are worse than state and national rates for this ratio. As you see in the chart on the bottom of your screen there, in 2022, we had 560 people in our population for every 1 mental health care provider. That has improved. Fast forward to this year, where we have 510 people per 1 healthcare provider. We know that in accessing mental health care, it's not just about these numbers, though, of mental health care providers. There's a lot more that goes into access. And this quote from one of our survey participants really sums it up, talks about a lot of different access issues, like people not knowing where to begin, having trouble with schedules, dealing with virtual appointments, which might be really challenging for some. And then you can have, maybe an overwhelming variety of people to choose from. That can be hard. And then last, there's a stigma to mental health that keeps people from getting the help that they need. So again, our mental health action team, when we first formed, we really looked a lot at what can we do to increase access to mental health care. And what we came up with as a group was we need resources for people while they wait for an appointment. They might be on a long wait list and their mental health challenges could be getting worse during this time. Or maybe they don't need to see a mental health care provider. Maybe they just need some self-care tips and tricks and help, right? So what we did was we partnered with a platform called Credible Mind. And thank you, Jody. She put it in the chat for everyone to visit. Credible Mind is an incredible website. It has tons, literally thousands of resources for you. There are health assessments that you can take to determine how well you're sleeping, if you might have depression or anxiety or another mental health care concern. There's so much. I really encourage you all to check it out at saukcounty.crediblemindcom. And that resource, I should add, is supported by SSM Health and Sauk Prairie Healthcare, in addition to Public Health Sauk County. So thank you to those who are making that possible. Our action team then became Prevent Suicide Sauk County. We started to focus on our second most alarming data point, which was that suicide attempts and deaths in our area are high, higher than state rates, as you can see. We had a peak of suicide in 2021. We attributed that to the pandemic effects. And then since then, our rate of suicide has decreased to pre-pandemic levels in 2023. So to look a little more, we all are very concerned about youth mental health. We know that youth, high school students, that is, they self-report mental health challenges at rates that are similar to other Wisconsin high school students. So you can see here the different measures that students report on. We have anxiety, depression, intentional self-harm, considering suicide, planning suicide, and attempting suicide in the chart that you see on your left. On the right, you see that some populations of students are at much higher risk than others. For example, our lesbian, gay, and bisexual students, 40% of them have considered suicide. That is twice the rate of other students as a whole in high school. So very high rates, that particular group. Also, other groups that have higher rates of suicidal ideation are people with a health condition, those who are food insecure, and those who receive low grades like D's and F's. So we need to keep that data in mind as we look for strategies. So what has the group Prevent Suicide Sauk County been up to? We decided to focus in on access to lethal means. And in simpler terms, that means that people who are in psychological distress, who are considering suicide, have very ready access to guns in our county. And we know that guns are a particularly lethal method of suicide. So we wanted to focus in on that. So what we've been doing is reaching out to our local gun shops, our hunter safety courses, and our gun clubs to talk to them about getting their staff trained in suicide awareness so they could see warning signs of suicide in their customers and their patrons, and they could also get them help once they notice some signs of distress and just open up a conversation about suicidality. Another thing we're doing is encouraging our gun shops to offer safe storage options. That means that if I have someone in my household who I'm really concerned about, and I have a firearm in my house, I could bring it somewhere and have it safely stored out of the home, far away from that person who is experiencing psychological distress. Research has shown that the more time you can put in between a suicidal person and access to a gun, the more time you can put there, the higher their chances of living are, because they have time to reconsider their ideas. We do find that a lot of people who die by suicide make that decision very quickly and act on it quickly. So this is why we're focusing on gun access. And now we're ready for our Menti, which is similar to the question you just looked at for housing, but this time focused on suicide prevention and mental health. So what else could the coalition, that is Prevent Suicide Sauk County, do to prevent suicide in our area? So please do share your thoughts here. So I see our first response is focus more on youth mental health. And, you know, that was echoed in our survey. A few of you remarked on how you were surprised by the youth isolation that was expressed in the survey. We know that our youth are struggling, including faith organizations. I love that because a lot of us do turn to our faith community, our pastors, for help for mental health. Excellent. And we have wonderful churches and other religious groups here in Sauk County. I'd like to focus too in that second comment on resiliency skills. How can we build those up so that we can roll with adversity more easily, roll with stress, and have higher tolerance skills for our own distress? Encourage organizations that often offer behavioral health programs to have same-day appointments. Wow. That would be excellent. I know, if you go to our Sauk County Human Services it's possible you could get walk-in care, depending on needs and priorities in the day. I don't want to overpromise, but it is tough to get those same-day appointments. Support group for LGB students. I love that. Thank you so much. It's a really great idea, since they are our highest risk group that's surveyed. Well, thank you all so much for these comments. Do feel free to keep putting them in. As Jody has shared, we might not get to looking at all of them right now, but we will certainly take them into consideration as this group continues to meet the third Monday of the month from 11 to 12 p.m. And we would love for you to join us. Jody is the facilitator of that group, so you can always reach out to her to get added to that list. Next, I'm going to turn it over to my colleague, Kate Hansen, who's going to talk to us about our third priority of substance use. Thank you.
Thanks, Sarah. So as she said, our third priority area is substance use. We're referring to the consumption of a substance that can affect your physical, mental, or emotional state. These substances can typically include alcohol, commercial tobacco, prescription drugs, and illicit drugs. Different drugs pose very different dangers, and drugs can lead to dependence, addiction, injury, accidents, other health problems, sleep issues, and more. In our CHA survey, 46% of our respondents selected alcohol, commercial tobacco, vaping, and other drug use as a community problem that we should work on, making it that third most selected community health problem. We know that substance use is a complex issue that impacts individuals, families, and communities. To make positive impact in this complicated problem, we need many different types of strategies across the rainbow spectrum you can see here on the slide. Promotion strategies are for everyone. Over there on the left-hand side in the green box, they focus on creating healthy environments where healthy choice is the easiest choice. Prevention strategies aim to stop people from ever starting to use alcohol, commercial tobacco, or other drugs, or to decrease its use before it ever becomes a problem. A lot of our prevention efforts focus on youth, and the quote here from our survey shows how important it is to create healthier environments for our kids. So our respondent said it was very disappointing to see a vaping store right across the street from the Baraboo Public Swimming Pool, tennis courts, and the skate park area where kids and families gather. Heading back to the rainbow, treatment programs in the red focus on helping those who are struggling with their substance use to reduce the harmful effects of their use or to quit altogether. And then recovery support services provide ongoing assistance to individuals in maintaining their sobriety over in the yellow. Here at Public Health Sauk County, we have developed programs across most of the buckets on this spectrum. We promote healthy environments, we prevent substance use, especially amongst youth, and enhance our links to treatment. Public health does not directly provide treatment services, and we do support a vibrant recovery community. My work particularly focuses on promotion and prevention, so next I'd like to share with you some of the data that describes how school-aged youth are using substances like alcohol, commercial tobacco, and other drugs in Sauk County. We know that our brains develop until about age 25, and studies show that earlier youth use of alcohol or other drugs, the more likely they are to have problems with addiction as adults, and the more damage they can likely do to key parts of their brain, including the areas that control memory, learning, mood, and mental health. Here in Sauk County, our high school students use at similar rates for alcohol and also for commercial tobacco. You'll see 31% of high school students in Sauk County have reported they've ever tried vaping, and about 14% report that they currently vape. We do see that the percentage of Sauk County high school students using tobacco products is decreasing. These are the traditional cigarettes, cigars, cigarillos, chew or smokeless tobacco, as we're seeing students using vapes more often.
We also know that Sauk County High School students use other drugs at rates very similar to other high school students here in Wisconsin. So when we look at marijuana or the cannabis, about 23% of our students have told us they've tried it at least once in their lifetime, and about 12% of students tell us that they currently regularly use marijuana. We also ask them questions about whether or not they've abused prescription medications, and we're about same with the state rate, as well as over-the-counter medications. And then we also ask them, a very small percentage state that they use any illegal drug as well. To address youth substance use prevention, we have developed and support our Partnership for Prevention Coalition. We were established back in 2017, and in 2021, we received the Drug Free Communities Grant. This grant allows us to develop our capacity and priority areas to focus on substance use amongst youth. Particularly, we focus heavily on the underage use of alcohol and tobacco, including nicotine vapes or other products, and prescription drug misuse across the lifespan. Our mission is through collaborative and strategic action, we empower communities to prevent the misuse of alcohol, tobacco, and other drugs. Our strategies focus heavily on increasing our community's strength through a coalition framework to address youth substance use. So we offer trainings, we connect individuals to conferences, providers to up-to-date information, and develop the sectors in our community that we all need to make our community a healthy place so that the healthy choice is the easiest. Some of our specific strategies we engage in include conducting compliance checks, both for alcohol and commercial tobacco, particularly vape products. This ensures that our local businesses do not sell these age-restricted products to persons under the age limit. We also encourage parents and other adults to say "not in my house" to underage drinking parties and provide them strategies to host parties in a safe manner that are alcohol-free for youth. We also do provide a lot of education and support to youth and parents through upcoming webinars, brochures, and resources on our coalition's website. We also focus on enhancing safe storage of prescription medications by distributing medication lockboxes and lock bags to anyone in the community who needs a safe place to store their medication. This also helps us enhance the responsible disposal of prescription and non-prescription medication by distributing at-home disposal kits such as Deterra or DisposeRx. And we also promote the permanent drug drop boxes that are located at our law enforcement centers here in Sauk County. So we're going to hop back onto that Menti. Hopefully you can pull up that tab on your smart device or laptop, whatever you're joining us on today. Head back to menti.com and tell us what else should our coalition be doing to prevent youth use of alcohol and vapes here in Sauk County. Implement more prevention in our schools. Absolutely. Schools are a very valued partner to our coalition, and we support whatever implementation of prevention activities they engage in. We advocate for school policies that support youth being caught using tobacco. Absolutely. We have worked with a few of our school districts and hope to work with the remaining few school districts that haven't considered this type of diversion option to connect students to either cessation and further education. A focus on marijuana, absolutely. We try to focus a little bit on marijuana and cannabis because vapes can be purchased with those liquids in them as well. For those with substance use disorder, there are not any AA groups in the area that are specifically for young people. That definitely could be addressed by my next colleague who will speak later on about how we support people in recovery. Absolutely. I think we've got one more there. More resources for keeping kids busy with activities that are good for the soul and the environment. Absolutely. So focus in on some of our community protective factors, things that are strengths in our community that keep us from using alcohol or other drugs. Absolutely. Well, thank you all for your comments. Our coalition does invite you to join us. We meet on the fourth Thursday of every month in a hybrid fashion. So you're welcome to join us in person at the West Square building in Baraboo. Otherwise, we also have a virtual option always, and our meetings are 1 to 2:15 p.m. We do have one upcoming event I'd like to plug here tonight. We have our Small Talks Big Results Let's Talk Vapes and Alcohol webinar. This is specifically designed for parents of kids in grades 3 through 12 and will provide you up-to-date brain science on how our brains develop as youth and why delaying substance use is so important to that development. We'll cover some of the current trends both in alcohol, tobacco, as well as cannabis products, and we'll give you plenty of tips on how to open up channels of communication with your child or teen about substance use. We do offer you a $20 gift card for participating, so go ahead and scan that QR code if you can. Otherwise, you can visit our website at saucp4p.org and you can find our registration page for our webinar. This is coming up next week, Tuesday from 6 to 7 p.m. I think that is it for me, and I'll turn it over to my colleague Hannah, and she'll talk a little bit more about our connection to substance use services.
Thank you. Good evening, everyone. My name is Hannah Erdman, and I am a health educator at Public Health Sauk County, and I work on our substance use programs as part of our community health team. And these programs include connections to harm reduction services, treatment, and recovery. So I'm just going to share with you a little data around opioid overdose deaths in Wisconsin. Sauk County has a very high rate of overdose. As you can see from the graph on the top left-hand side, we had a spike in fatal overdoses in 2020 with a total of 21 fatal overdoses in Sauk County. That's the highest we've seen it since we started collecting data in 2012. We have seen a decrease in fatal overdoses in recent years. As you can see, in 2023, we had a total of 8 fatal overdoses. We are still seeing a continuing trend of fentanyl lacing stimulants, specifically lacing methamphetamine and cocaine, which is making them more addictive and more deadly. We are also seeing polysubstance use, meaning that individuals are taking more than one substance at the same time, whether they're aware of it or not, which is really where we're seeing prescription opioids involved, potentially heroin involved, as you can see from the graphs. Unfortunately, Sauk County's non-fatal overdose rate has not been decreasing. It has not been following the same trend as our fatal overdoses. So in 2023, Sauk County was in the top 10 counties in Wisconsin with the highest rate of opioid overdose hospitalizations for non-fatal overdoses. In December of 2022, Public Health, in partnership with community members and organizations, started a coalition to support recovery in Sauk County called Support People and Empower Recovery, or SUPER. SUPER is working to create safe, inclusive, and supportive communities where everyone can recover and thrive. Through community feedback, data collection, and discussion, we identified 3 priority areas that people in recovery struggle with in our community. These include social isolation, transportation, and housing. SUPER has been working to address social isolation by hosting more alcohol and drug-free events in our community to help encourage social interaction by creating a safe space for people in recovery. We have had 3 large social events to date, including our Super Lunch in May of 2024, and we have had 2 Day at Devil's Lake events in August of 2023, which was our first event, and in July of 2024. We have had great success with these events, and people have asked us to host monthly events. So they have more opportunities to get together in the community and form positive relationships and connections. Based on this feedback, Super will begin hosting monthly events starting later in October. Another part of my job is working on our harm reduction programs. These programs are to help keep people alive and help them take a positive step toward better health. In 2017, Public Health Sauk County was the first rural health department to train and equip community members with free Narcan nasal spray. Narcan nasal spray is something that can reverse an opioid overdose and save a life. Public Health Sauk County continues to offer free training either in person or online. Last year, we started a free on-demand self-paced e-learning course for community members to learn how to use Narcan to reverse an overdose. We also work with EMS. We also worked with EMS to start an EMS Leave Behind program. So this is when EMS is on a call and thinks Narcan would be beneficial for an individual to have or to have in the home. They can leave Narcan in the home or with the individual. Someone can also request Narcan from EMS and they can give it to them in that moment. In January of 2023, Public Health also partnered with SSM St. Clair in Baraboo to install a free public health vending machine at the ER entrance. This machine dispenses free Narcan nasal spray, at-home medication disposal kits, and community resource kits. Another vending machine will soon be installed at the SSM Health Urgent Care in Lake Delton. Public Health Sauk County also offers free fentanyl test strip kits. These test strips can test any drug for fentanyl. This includes cocaine, methamphetamine, counterfeit pills, and heroin. They can all be laced with fentanyl, and it takes only a very small amount of fentanyl to be deadly. And as you saw on the graphs previously, fentanyl is very common in our community. You can't see it, taste it, or smell it to determine if it is lacing another drug. It does require a test strip in order to test the drug and see. Public Health also offers free xylazine test strip kits. These test strips test any drug for xylazine. Xylazine is a non-opioid tranquilizer that sometimes laces fentanyl and is not approved for human use. And these test strip kits are offered to any community member for free. In 2021, Public Health partnered with EMS agencies and our WisHope peer recovery coaches to start Sauk County response teams. This is a team composed of EMS and a WisHope peer recovery coach. They make at-home or in-facility calls to those who are seen by EMS for anything substance use related. The goal of this team is to streamline a connection to treatment, harm reduction, peer support, and other services. And Sauk County has the first rural response team program in Wisconsin. Now, in 2018, Public Health started the Sauk County Overdose Death Review Team. This team confidentially reviews overdose deaths and recommends changes in policy, programs, and practice to reduce overdose deaths. We were the second team in Wisconsin and the first rural team. We also have the medication-assisted treatment providers and coordinators. Providers and coordinators that distribute MAT started meeting to work on increasing access to medication-assisted treatment, or MAT, in Sauk County. And this team meets the first Wednesdays of every month from 10 a.m. to 11 a.m., both online and in person here at the West Square building in Baraboo. All right, so now we are going to move on to the Menti slide. You can scan the QR code on screen, or you can go to menti.com and enter the code that is in the chat. And we are asking you to think about and share what else can we do better to connect people to substance use treatment and support people in recovery here in Sauk County. Promote, yes, that is very, very important. More sober living and housing options. Absolutely. That is something that we have been looking into and is one of our priorities in Super. Transportation and housing. Absolutely. That is one area that everyone, including people in recovery, really struggle with in our county, with housing costs being so high and very limited housing. More AA groups. Yes, there are very limited AA groups in our county. We definitely need more. And recovery-friendly employment opportunities. That is a great point. Thank you for putting that. That is very important to think about and remember. Not everyone is open to hiring those that are in recovery, and we have been working with some businesses to encourage a recovery-friendly environment at their place of employment. Well, those are great. Thank you so much. And please continue to add to that Menti poll. As was mentioned previously, we can't mention everything that was in the polls, but we are collecting that data and we will use it to help guide our choices and decisions in the future. All right, so just a couple more slides. Super meetings are held the first Monday of every month at 1 p.m., both virtually and in person. And this is where you can bring your ideas to us and join the coalition, whether it's become part of our coalition, join our email list, even if you can't attend the meetings. If you would like to just share some ideas with me, I am more than happy to have that conversation with you through email. If you would like to attend in person, we are meeting at the new Wishope Sauk County Community Center in Baraboo, which was just opened about a month ago. And if you would like to join Super or help out with the events or volunteer at the events, please let me know. My contact information was just put in the chat by Jody. Thank you very much. Reach out to me and I'd be very happy to have you join us. So as I previously mentioned, Super is going to start hosting free monthly community events starting this month. So Super will be hosting a Halloween movie night on Friday, October 25th at 6 p.m. at the new Wishope Community Center in Baraboo. So we do ask all attendees to register. We're going to have free food and transportation options for those who struggle to or may not be able to come on their own. Hopefully we can offer transportation for them to attend as well. So these will be all free events and open to anyone in the community. All right, that is all that I have for you. And once again, I will hand it off to Jody Molitor, who will wrap up our evening for us.
All right, thank you very much, Hannah. I really want to thank everyone for joining us tonight. If you would like to see a complete report on all of the data that we compiled and all of the information, all the focus groups, please either scan the code on the screen there or go to bit.ly/SAUK CHA 2024. And there's the link for that that I just put in the chat also. So I'll give you just a moment in case you wanted to scan that. And the other thing that I wanted to ask is that everyone please complete a very short feedback survey. We really would love to know what you thought of everything, how you thought tonight went, and if you have any other comments or questions for us, this would be the place that you can leave them. Again, you can either scan the code on the screen or you can follow the link in the chat. So thank you very much. I want to thank everyone for attending and we'll let you go a few minutes early. Have a fantastic evening.